In 2013, a horrific story came out of a San Francisco hospital where a confused patient wandered into a little-used stairwell and died. Later, it was learned that a hospital employee had stepped over her body twice, only telling a nurse the second time. And even though that nurse notified security, they still didn't find the woman's body for another week. An extreme example of medical errors for sure. As a physician, I'm very aware of medical errors, but it wasn't until last year that medical errors knocked at my front door. My older sister, Anna, she'd had her health struggles, and in 2013, she had a bone marrow transplant. Initially, she did great, but 7 months after her transplant, she began to have some odd neurologic symptoms. And 5 months after that, she began to have chest pains. When she told me about the chest pains, I told her she had to go to the ER. But even though I'm a doctor, to her, I was just her kid sister. So she asked her physicians at the teaching hospital. The first recommended acids. And when her chest pain persisted, another told her her nerve pain medicine was treating it, and no one bothered to look any further. Anna got worse. She lost sensation below her waist and was hospitalized near her home. After she was transferred back to the teaching hospital, her neurologic symptoms improved. But her chest pain was continuing, and she was very short of breath. It wasn't until the 12th day at the teaching hospital that a cardiologist finally evaluated her. And by then, she'd lost 50% of her heart's pumping power, and she needed a coronary stent. My sister had had a heart attack. The morning after she received her stent, I was with her in the hospital room. And she would doze on and off, and I just sat quietly in the corner. And during one of her waking moments, she said to me, "I thought I was dying the other night." I didn't even know how to respond. I just reached for her hand, held it ever so tightly. And we both began to cry. And we sat there crying. And she went on and she said, "I am so mad." And I knew instantly why. For months, she had told her doctors about her chest pain, and no one had taken her seriously. And now she'd had a heart attack, and parts of her heart were deemed unsalvageable. Due to her physicians not pursuing her symptoms, she literally paid with her health. So we sat a while together, just holding hands, tears streaming down our faces, and she said to me, "Are you going to go after this?" And my response was, "Well, do you want me to?" And emphatically she said, "No one should ever go through what I've been through." We never spoke about it again. Unfortunately, she died several days later. Her autopsy said she'd been having ongoing waves of heart attacks. Initially, after her passing, I was in shock. And then my anger was off the charts. I was convinced her death was preventable, and I was driven to find the truth. So I reviewed all of her medical records, and I was right. Her death was preventable. And from all my research, I also knew hers was not an isolated case of a death from medical errors. My mission now is very clear. Silence is not an option. I openly share Anna's story and what I've learned about harm from medical errors. Like most doctors, I focus on giving the best care possible, but none of us are perfect, no way. And like all providers, I can count the several patients I have harmed significantly, but inadvertently while treating them as a doctor. One patient of mine, she was about 50, and she had belly pains, diarrhea, and weight loss. I saw her 3 times, ultimately referred her on, but she had an infection that I should have diagnosed and treated, but I definitely missed. Luckily, she survived, but her illness could have been fatal, and it did last much longer than it should have. But she gave me the ultimate gift. She called me and informed me of my mistake. In medical errors, the ones I worry about the most are the ones I don't know about, the medical errors that have not yet come to my attention. Those are the ones that I agonize over. In medicine, the first large focus on medical error reduction began in 1999, when the Institute of Medicine released its report, To Err is Human, which highlighted how medical errors harmed a huge number of patients. In an independent follow-up report in 2013, it showed no real progress had been made on medical error reduction. And it estimated that 200,000 Americans die each year. 200,000 Americans die each year due to medical errors. It's our 3rd leading cause of death in this nation. It follows heart disease and cancer. A new Institute of Medicine report is due out in the fall of 2015. And my prediction, the estimated lives lost will remain astronomical. The culture of healthcare is only starting to embrace the statistics around medical errors. I graduated in my fellowship in 2005, and as trainees, we received almost continuous feedback. But in my 9 years of medical training, I only recall one example where I saw a physician who actively gave feedback to another provider who wasn't in training. I was working alongside an orthopedist, and he noted the wrong care given previously by a nurse practitioner, extending a patient's recovery time. He called her, he thanked her for caring for the patient, and then recommended a different splint for the next time to improve care. On the other hand, I remember numerous examples when I was a medical student or a medical resident when I'd asked my faculty mentors, why weren't we giving feedback to physicians on outdated or incorrect care? Once, while working alongside a cardiologist, he noted that the primary care physician was not dosing their mutual patients' medications correctly. When I asked him, shouldn't we inform that doctor? He said, we don't do that. Why not? So where do we go from here? What about my sister Anna? Our family chose not to pursue malpractice. Money won't bring her back. We want more than money. We want change. We want institutional change in healthcare. And I think that's the hope of most families that have been afflicted, is to know that their loved one did not die in vain. So I returned to that teaching hospital multiple times, in fact, asking to hear what changes had been put in place to prevent more deaths like Anna's. You see, when I reviewed her medical record, it was full of cut and pasted notes with outdated information. One of her physicians confessed to me that although he had written a note on her, he had never seen her because it was late at night. Another, when asked, why didn't you pursue her chest pain symptom, said, I'd have to refer all my patients to cardiologists, for which I said to him, sir, you could have been a hero. So what do I say to the healthcare executives, those in leadership positions, to prevent more deaths like Anna's? It's time to step up. You need to commit manpower and resources to find safer ways to deliver care. Lead with transparency and accountability, and help your providers be more engaged. And what do I say to my fellow physicians, those alongside me in the trenches to prevent more deaths like Anna's? We all must listen to our patients and document care like we'd want our own loved ones' care documented. We must confront our colleagues if there's any question about a patient's safety, and consider it a gift if a patient or a colleague approaches you with a safety concern? And what do I recommend to you or your loved ones if undergoing care today as lessons learned from my sister's death? Remember, you know your body better than anyone else. If a symptom persists, question why. If necessary, get another opinion and another. If you or your loved one believe you've been harmed, speak up. Request changes. Share your story. So I wonder, hopefully along with all of you now, how can we get the nation's attention on preventing medical errors? It's our third leading cause of death. Where is the outrage? How many more Annas must die? For you see, even over the death of my precious sister, the ultimate medical mistake is the deafening silence that continues to surround medical errors. Thank you.